Guys, my name is Chianti Zerner and I am a first-year NAU PA student studying at the downtown Phoenix Biomedical campus. I'm going to be doing the day in a life today of an NAU PA student, and if you have any questions about the PA profession, our program, or just being a PA student, just feel free to tune in. So right now we're doing a mix of virtual and in person, so it kind of just depends on the class. So right now we're doing pharmacology, which is virtual from 9 to 12. 12 to 1 is our lunch break, and then from 1 to 4 we have Foundations of Clinical Medicine. Right now we're learning about hypertension and risk factors, as well as the pharmacology that we're going to be using to treat it. And our classes usually align with the same body systems, which is really great.
Hi guys, my name is Rebecca Gonzalez and I am from San Antonio, Texas. I'm a first-year PA student. Prior to attending NAU's PA program, I was a Spanish oral interpreter. One of my favorite classes so far has been history and physical exam. We learned about different organ systems as the semester went on, leading to having to complete a full physical exam at the end of the semester. My favorite memory was when we received our white coats, and I'm very grateful to be here. Hi guys, my name is Rebecca Gonzalez and I am from San Antonio, Texas. I'm a first-year PA student. Prior to attending NAU's PA program, I was a Spanish oral interpreter. One of my favorite classes so far has been history and physical exam. We learned about different organ systems as the semester went on, leading to having to complete a full physical exam at the end of the semester. My favorite memory was when we received our white coats, and I'm very grateful to be here.
So today we have with us one of our NAU professors, Ms. Amber Brooks Gumbert. She is a former Mayo Clinic PA.
Hi there, I'm Amber Brooks Gumbert. I used to be a hospitalist PA at Mayo Clinic, but for the last almost 3 years I've been faculty here at NAU, and today we're down in our simulation lab, and we've got Harvey here. He's one of our simulators for heart murmurs. So this is one of the ways that we can demonstrate heart murmurs for our students to give, a real live, immersive experience for the students so they can hear some heart murmurs.
So tell us why you picked NAU.
Oh gosh, that's a great question. I love the idea that NAU, one, is a state institution. It's the only state school for PA schools here in Arizona. I love the fact that we do holistic admissions for incoming students, and not the everyday PA student that applies is going to apply to all the other schools around the country. We really take a second look and really care about the students that are applying to NAU, and I think that puts us, separates us from some of the other PA programs around the country.
This is one of the simulation models that NAU has, and what you're hearing right now is a basically normal heart. So we're going to be showing how PA students can learn to differentiate different types of heart murmurs.
That's right. So this is Harvey. He helps us learn how to differentiate heart murmurs. So right now you're listening to essentially a normal heart. It kind of sounds like that if you can hear it in the background. We can listen to the different valves. Here we have the aortic valve. Here we have the pulmonic valve, second pulmonic valve, tricuspid, and over here we've got mitral. All right, well now, let's see if we can get in the right position here. Harvey sometimes is a little fussy. All right, now we're going to listen to quite the exotic murmur. Not really. This happens to patients as they age. It's called aortic stenosis. Wow, that's some whoosh, huh? Now you'll hear it, we're listening over the aortic valve, so obviously it's the loudest. When we move over the pulmonic valve, it gets a little quieter. And as we move away from the valve, it gets even quieter again. So this helps us teach our students the differences between the different types of murmurs and the valvular abnormalities that are associated with them. So in a typical simulation case scenario, on the other side of this double pane glass is the control room. And on the other side is someone who is actually controlling the simulation models, vital signs, including blood pressure, heart rate, in real time. You can even change the dynamics of what the patient is doing, changing their heart rhythm even based on what the PA students is doing as far as therapeutics that they're giving to the patient. So let's say a patient comes in with chest pain per se, and the PA student is evaluating that patient and they're giving them things like beta blockers or morphine or oxygen or nitroglycerin. In the control room, the person in the control room can change the patient's heart rate, even heart rhythm, blood pressure, oxygen saturation, based on what the PA student has given the patient as far as therapeutics, and change that scenario. So in real time, the student is able to learn what the patient is dynamically doing. That way, it's a very secure and safe environment of learning, rather than a real-world scenario where something tragic could happen. So it's a very safe environment for learning.
Our crash carts that are specific for this sim center. So we have our medications and then intubation tools.
And here we have our simulation mannequin, where again, we can actually have the patient even hooked up to IV medications, fluids. Here on the monitor, we could have real-time vital signs, EKG, visualized here on the screen. We could also have telemetry monitoring, O2 monitoring as well. We could have dynamic changes here in the control. We could have the facilitator changing things in real time based on the therapeutics that the PA students are administering, based on their evaluation of the patient here, and they would see all those changes on the monitor in real time. And so also, whenever you're examining the mannequins, you can also hear real heart sounds and breath sounds, and even hear changes such as rails, you can hear heart murmurs, all those things, even vowel sounds. We can even change the mannequins to simulate things like edema in the lower extremities and all, there's no limits to what kinds of things you can do with the mannequins. Really, the only limitations are your imagination. And so it's such a great learning.
I just got out of my last class of the day, which is Foundations. It goes from 1 to 3, and we were basically doing case studies on hypertension and hyperlipidemia. We had a study of patients that were coming in, the initial office visit, type of diagnosis you're going to expect, what family history is relevant, what are some lifestyle changes they need to make, and then followed through with what type of prescriptions we would do, what type of labs, and what type of follow-ups. So that's pretty much it for my takeover today. Thank you guys so much for taking the time to tune in and learn more about NAU's great PA program. I'm going to spend the rest of the night studying for my pharmacology exam on Friday, so thank you guys so much.